How can CF patients know if exercise clears their airways? Imagine feeling your lungs open up after a good workout. For people with cystic fibrosis, knowing if exercise is helping clear mucus from the airways is important. One way to tell is by paying attention to how much mucus they cough up after exercising. If they notice more sputum than usual, that can be a sign mucus is moving out of the lungs. Also, if breathing feels easier with less chest tightness or coughing, it might mean the airways are clearer. Another helpful method is lung function testing, like spirometry. This test measures how much air a person can blow out in 1 second. If the numbers stay steady or improve after exercise, it suggests the lungs are functioning well and mucus might be clearing. But it's important to remember that exercise alone isn't a replacement for traditional airway clearance techniques. It can be a helpful addition, but not a standalone solution. Patients can also use questionnaires or symptom scores to track how they feel overall. If they notice fewer breathing problems or less coughing after exercise, that can be a good sign. Some specialized programs combine exercise with breathing techniques, like huffs and coughs, to boost mucus removal. These structured approaches can sometimes be more effective than just being active. Since cystic fibrosis varies from person to person, it's best to work closely with a healthcare team. They can help monitor lung function over time and suggest the best ways to include exercise in airway management. Sometimes, a healthcare provider might recommend supervised exercise sessions or regular checkups to see how well exercise is working for each individual. In summary, CF patients can tell if exercise is helping clear their airways by noticing more mucus being coughed up, feeling easier to breathe, and seeing stable or improved lung function tests. Remember, exercise should complement traditional airway clearance methods, and always discuss any new routines with a healthcare professional. Personalization and professional guidance are key to safely and effectively managing cystic fibrosis.